Doctor, a lot of patients that I've talked to have come in with that have had cancer and had radiation treatment, which can leave, correct me if I'm wrong, scarring or other damage to the tissue that's close by. But they've seen success with hyperbaric oxygen therapy. So what's going on there?
So with delayed radiation injury is one of the FDA-approved conditions for hyperbarics. The radiation itself treats the cancer, which is a good thing, but the side effect is that it can damage surrounding tissues for where that radiation occurred. So patients that may have had radiation for head and neck cancers, breast cancer, prostate cancer, there can be injuries to tissues surrounding the face, the jawbone, chest wall, the bladder, and the rectum, which destroys tissues, causing fibrosis, inflammation, pain, typically bleeding, limited range of motion. And so with hyperbarics, doing enough hyperbaric treatments can help improve the blood flow, angiogenesis, promoting new blood vessel growth to those areas, the cell growth, the stem cells, proliferation of the architecture, the original architecture that occurred prior to the damage, trying to bring the tissues much more back to their normal state.
And in that process, depending on where that injury is, people can regain functionality a little bit better from what they had previously, right?
They can. So my experience of men that have had prostate cancer that presented with painful bleeding episodes with urination, by the time they finished their hyperbaric treatments, all of that had resolved.